Over the past few days, several states and cities across the country releasing COVID-19 outcomes by race. The preliminary numbers reveal that Black people are facing higher risks when it comes to the disease caused by the novel coronavirus. Many people now wondering if the pandemic will ultimately become a Black pandemic. Joining us now is Vice President and Chief Medical Officer at Blue Cross and Blue Shield for Illinois, Dr. Derek Robinson. Thank you so much for joining us this evening.
Thank you for the privilege to be with you, Laverne.
This is extremely disturbing. We've been seeing this trend over the past couple of days. Now we're seeing actual numbers. Can you tell us what your thoughts are on how Black people are being affected by this?
Sure. So what we understand about COVID-19 or the coronavirus is that individuals that have chronic medical conditions like high blood pressure, diabetes, and COPD are at higher risk for having a poor health outcome. Now, generally, most individuals that get this infection will do well. But those individuals who are going to have health complications and potentially be in the intensive care unit or unfortunately die are individuals that have at least one of these medical conditions. And one of the things that we do know is that in the African American community, we do have a high prevalence of diabetes and high blood pressure and obesity and a number of the other conditions that can put people at risk for having a really poor health outcome with this infection.
We're hearing this now. It kind of came out of nowhere. There was a time early on where people were saying Black people couldn't even get this. What can people do about this now? Is there anything?
Sure. So a lot of misinformation has been around. I think we have to offer each other some grace. We've known about this infection for about 4 months globally. So what we do know is that you can't look at an individual and tell whether or not they're infected. We do know that individuals are contagious before they begin to have symptoms, and whether those symptoms are a fever or a cough or some of the other symptoms, you can actually spread the infection prior to that. And we know that social distancing allows you to be far enough away from individuals so that you don't get exposed to the virus through droplets. But we also know that you can pick up the virus from contaminated surfaces. So it's really important right now during the height of this pandemic that individuals shelter in place, that they stay at home. If individuals have to go out, that they practice social distancing. And I think particularly for those individuals who are elderly, those individuals who have chronic medical conditions, rely on a family member or friend to actually go out and get items for you and have them bring them back. So that way you can lower your risk. And the other thing that's important is while you may know a friend, know a family member, it's not a time for a lot of gathering and commingling. The social distancing is really important, and maintaining your bubble is going to be the thing that's going to allow you to stay safe while we learn more about this condition, effective treatments, and what our path forward looks like.
This is something that has become the new norm. That's what people seem to be calling this. But it can be difficult for people going through all of these things, trying to social distance and grocery shop at certain times, whatnot. Do you see any type of relief coming soon, or do we have to be realistic that this could be a while?
Yeah, I think realistically, I think we definitely have at least a few months of this ahead. And I don't have a crystal ball. And again, we are learning more about this infection on a daily basis. I'll share with your viewers what I share with my family members, and that is that, again, we have to practice the social distancing. I'm a native of Louisiana, which is a state that's been hard hit by the pandemic. And when I've had conversations with my dad and other family members, I've had to share with them, again, you can't look at someone and tell whether they have this. So our culture of shaking hands, giving folks hugs, the things that we usually do that are just part of how we engage with each other, we're having to change those customs. And I do believe that at some point we will get back to the type of engagement that we're used to, but that's going to take some time. We're going to have to learn about what are the most effective treatments for the infection. Who are individuals who've had the infection but now have immunity to it, hopefully, and they can return to the workplace. And then the development of a vaccine and getting individuals vaccinated. So we have to work through this process as a society and really as a global community to get back to what we all recall as being our normal. So when we get to this new norm, it won't be the same as the norm before. I think it's going to take a little time to get back there. And I think patience is something that's going to be really important.
Dr. Robinson, I want to ask you about pregnant women or newborns, because we have also heard different views on that. What are your thoughts on the
Sure.
risk factor for them?
Sure. Well, we know during some of the past, flu epidemics that we've had in years past that there was some higher risk for poor outcomes for pregnant women. What we've seen so far with COVID-19 is that that has not been the case, and I'm aware of at least 2 studies with small numbers of individuals, one study in China, one also recently from New York, where they looked at pregnant women who delivered a baby, and they found that generally the women had good health outcomes, and that also in most instances there was not what we describe as a vertical transmission of the infection from the mom to the child. So again, these are it's a glimmer of good news in the face of this pandemic, but certainly something that physicians and health experts will continue to track as we continue to care for more individuals with the infection.
And what about children? Are they higher at risk, or are we still seeing cases where that's not a concern as much for our children?
So most of the data that we've seen both in the United States and around the world reflects that children generally do well with this infection. Now, that doesn't mean that you're not going to have some isolated cases where a child does not have a good health outcome or, God forbid, actually passes away from the infection, but generally the children are doing well. I think one of the things that we should clarify, we talked about a lot the really high death rate in older individuals in China and in Italy, and we're beginning to see that in the United States. And I think, unfortunately, that was misinterpreted as for young folks to believe that they would not be at risk for infection. When I say young folks, I'm talking about individuals who were in their 20s and 30s. And what I think was sort of glossed over was that while individuals in their 20s and 30s and 40s generally will survive the condition if infected, when you look at the hospitalization rates and the intensive care unit stays, a lot of individuals in those age groups did find themselves in the intensive care unit, many on ventilators. And so it is a very serious condition that folks of all ages have to take seriously. And again, when we think about how our families convene together, if you have children that do generally well with the infection, that can be contagious but not symptomatic, and they spread that to their grandparents who may have chronic medical conditions and are at risk for not doing well with the infection, that's really a bad combination. And so that's why it's really important for us to listen to our public health professionals, listen to our physicians, really adhere to the social distancing measures that we've been advised.
Well, wonderful advice. We thank you so much for all you do in the healthcare profession, and we thank you so much for joining us with this great information, Doctor.
Thank you for the opportunity.